I just noted that I'm up first. I'm Ralph Schulz. I'm CEO of the Nashville Chamber, and I want to thank everyone for the opportunity to be here. I'm really looking forward to the content of today's panels myself. Take back some great learning. I want to acknowledge Mayor, we know him as Mayor in Nashville, Mayor Bill Purcell, who stimulated prosperous growth in Nashville as well, and actually was the person that first suggested to us at the Chamber that this health issue, population health issue, was an important issue for our prosperity going forward. So as I begin the presentation, I do want to say that I had the good fortune to be the head of the Chamber at the time that the recession reversed in Nashville, but I didn't personally make it happen myself. I'd love to take credit for that, but Nashville is one of those great communities that once they identify a priority and a need for the prosperity for the whole community, they are motivated to do something about that, and that's part of what I will talk about here today. First of all, why do we as a chamber care, and why should some institution or some organization in the community care about this issue? Well, here's what's happened to prosperity and regional and community prosperous growth over the last 10 years or so. Prosperity is dependent on job growth, and job growth is now dependent on workforce availability, and workforce availability is tied directly to lifestyle. When you look at the generations that are rising to be the labor force of the next 20 or 30 years, you see lifestyle as a key issue for them. It used to be that you recruited jobs to a community to create prosperity, but that has now become making sure that your community draws workforce because the jobs follow the workforce and the prosperity follows the jobs. If you look at the unemployment rate in Nashville, Tennessee right now, you will find it to be at 3.3%. In some areas of our region, it's at 3.0%. That is below the level of unemployment that we can use to provide workforce for the job growth that is taking place. That's created a couple of dynamics for our business people and a little more awareness on the part of business people. Number one, they are working harder to retain their workforce. Number two, they are beginning to examine productivity as a portion of their workforce. And when they think about creating jobs, they are looking at things like presenteeism and absenteeism as measures of how they can cause that workforce to be as productive as possible for them. And they will shift those jobs to other places if they find healthier environments or they find a surplus of workforce. No, those are all of my ad-libbed comments. I'm going to move through my presentation really quickly, and then look forward to questions coming later. So, CEOs in our region and businesses in our region are starting, in fact, to pay attention to the health culture and the population health of their workforce. Can we solve the problem? I think we're really close in Nashville. We think music is the answer to death. We think that's the antidote to death, and we're working really hard on that. But the fact of the matter is that 70% of the deaths in the United States are attributable to chronic conditions. And those chronic conditions, the contributing factors include poor nutrition, physical inactivity, smoking, and mental health issues that are untreated. And we've done work and research in our community to identify the significance of those issues. Business leaders know that there is a cost to these issues. The cost of absenteeism is 28% higher than the employee's wage, and the data shows that low productivity from presenteeism, which is kind of a new feature for businesses to measure and look out for, accounts for 20 to 60% of the healthcare costs for the employer. In other words, the lost productivity is an identifiable cost for them of people who are coming to work sick. And so they've begun to focus on this issue. Companies in the region are starting to take notice of this and do things. You will find particularly the advanced manufacturing industries that are starting to install some of these health culture programs within their businesses, like Nissan, Volkswagen, Dollar General, and Asurion are all companies in our area that are doing this. So they definitely understand the cost. Now, what was necessary to begin a process, a movement in our region to address these issues? The very first thing that our CEOs and our business leaders expect is data, information, and objective material that they can study. A couple of years ago, we bound with an organization, FTI Consulting, to do a unique study on of the health environment in the Nashville area. We needed the credible data that this study would generate because we know business people will react to that real data. They need data on the health of their employee population, how it compares to the larger community. They need, more importantly than anything, measurable outcomes. In other words, if I take steps to address the problem, how will I know I'm succeeding? And then they need some sense of the cost and the benefit, the ROI. If I invest in the employee's health, how can I measure the return on my investment? So, those were some of the questions that framed our discussions when we launched a pilot study. First step was to reach out and engage our stakeholders. Those diverse stakeholders included people like Community Health Systems, CHS, Blue Cross Blue Shield of Tennessee, the Baptist Healing Trust, HCA Foundation, and a variety of the stakeholders that exist in our area. Each one of them brought unique practices to the discussion, but most importantly, I think FTI brought a unique methodology. They obtained Medicare data and proprietary healthcare claims from insurers in Nashville and 10 peer cities. So this is where I want to digress for just a second. It's important in our community to understand the health environment of our region of 1.6 million people, but it's also very important to understand how we compare to other communities that we consider benchmark communities. There are a couple of great byproducts of that to that effort, but one of the important emotional byproducts is that our business community loves to compare themselves to other business communities like Austin, Charlotte, other regions where we're competing on a prosperity basis, and they want to know how we compare to each of them competitively. It seems like a competition. It doesn't seem like the humanitarian motivation, but in fact, when they look at 9 chronic issues and they see we are below par on 3 of those issues as compared to those benchmark cities, it becomes a motivation and a target for them to say, we need to address these issues so that we're as good or better than our benchmark cities. So, the FTI methodology was really key and really unique because it helped us adjust for the demography of our region, and it opened us up to more information than we had ever been able to look at before. FTI also helped us study how many hospitals and doctors, basically cataloging the community assets. We were looking at, okay, if we can identify the chronic issues that are affecting business, then what can we do about it once we've identified those priorities? So they helped us to assess the assets in the community that we could apply toward those priorities. And one of the great things that we learned, and I'll be happy to share that study with you, one of the great things we learned is that Nashville does in fact have the medical personnel available, the insurance availability, the insurance utilization. There are a variety of positive assets that we can apply to change these features. So here you see some of those assets. And you can see some of the liabilities that we were dealing with. No peer city comparison. A third of the adults, 17% of adolescents are obese. You know what that does. Meg and I were just talking earlier, and hopefully she'll refer to this at some point today. We've begun to look at that 45 to 64 age group because that's where the workforce is coming from in the next 20 years. And we're finding that the obesity in that group is significantly higher than the general population of our region. That does not bode well for the continued prosperity of our region going forward, both in terms of the employee health to sustain their time in the workforce and the effect of that obesity as they are arriving at work, oftentimes now chronically ill. So we're really looking at that issue in a big way. There we go. So what business needs? If you're going to motivate the business community to become engaged in this issue, you have to become more granular. It's helpful to them to understand the general population health climate of the community, but they also want to know, what does it mean to me? What does it mean to my workforce? They have a demography for their workforce. They can compare that demography against our data, but then they need to be able to explore what difference is it going to make to their company and their productivity. I often say in Nashville right now that the people who should be most concerned about this are the people that are in line to become the CEOs in the near future. Because for the next 20 or 30 years, their productivity and leadership as CEOs is going to be directly affected by the health of their workforce, especially as we look at what has happened to the workforce with birth rates over the last 30 years, the departure of boomers. Boomers are checking out of the workforce. That is putting the squeeze on every business to have that talented workforce. And if you're a CEO of the future, you better care about the health quality of the people that are a part of that workforce in the future. I'll just conclude with this. Number one, our responsibility in the community was to provide stimulus to the discussion. In order to provide that stimulus, we had to have real data. The quality and the significance of the data generated through that, at what we call the FTI study, the study that was conducted with FTI, has provided that objective information that is now causing businesses to want to engage in community-wide activity to begin to alter the health culture in Nashville, which is really pretty poor. It's in the we're in the low proportion of health quality across the United States. Having achieved that data and having convinced some of those CEOs, we are undertaking pilots with organizations, with businesses, to begin to reshape that health culture. We are undertaking policy work at the state legislative level to reshape that health culture. And I have to say that last mayors have been focused on this healthy culture, both in terms of the policy that they've instituted, but also the development of infrastructure and that sense of the built place in Nashville, so that it encourages a lot of physical activity if you live in Nashville. So, thanks for allowing me to be here. I've heard the panelists, and they're going to deliver you more value than I've been able to deliver you, but our important representation here is our organization is one of those organizations where the rubber meets the road, and those are the kinds of things that we see our role stimulating that healthy culture going forward. So thanks again, and I look forward to hearing the rest of the panelists.